Hi, everyone. My name is Lynn Crawford. I'm with Hope Dementia Support, and I'm here today with this wonderful panel of experts to talk to us about home care and placement. And I'm going to allow each one of them to introduce themselves and tell you a little bit about their organization. And I'm going to start with Trevor Johnson.
Hello, I'm Trevor Johnson, and I work for CDM Caregiving Services, and we are a caregiving agency here in Clark County, and yeah, a nonprofit, and our whole goal is to provide coordinated in-home care services to as many clients as possible.
Thank you for being here, Trevor. Christina.
Hello, I'm Christina Hinksler with First Choice Advisory Services. First Choice has been in business for 32 years now. I've been grateful to be in Clark County working with seniors for the last 7 years, helping hundreds of families find the right match.
Sarah Sheets.
Hi, I'm Sarah Sheets, and I'm the owner of Senior Living Locator, and I've been working in long-term care here in Clark County for 19 years now. And we help people with placement services or also navigating other services like in-home care or, the adult day center if it's not the right time for placement.
Julie Williams.
Hello, I'm Julie Williams, and I'm the owner of Home Instead. We do in-home care here in Clark County. We're coming up on our 20-year anniversary next year. We're excited about that. But yeah, we provide care in the home.
And Debbie Dockstetter.
Hi, I'm Debbie Dockstetter. I'm the care coordinator for PNW Aging Specialty Services in Vancouver, Washington. We provide in-home.
Debbie, we lost part of your conversation. But
care coordinator for PNW Aging Specialty Services in Vancouver, Washington. And we do in-home care. We do healthcare power of attorneys. We do have case management.
Wonderful. Thank you. Got it that time.
Okay, thank you. Okay, thank you.
So before I open to questions from the audience, I would like to throw it out there that I would like someone to give us a definition of home care and what kind of things are provided by home care and when it is appropriate to seek it. And Julie and
to do that.
And all of you. Perfect. Go ahead. Go ahead, Debbie.
Oh, in-home care, what we do is we customize a care plan that is specific to your loved one's needs. And we do everything from light housekeeping to personal care, hygiene, transportation. We're there for companionship and to keep someone safe at home. And you'll know when the time is right, when you start to feel a little stressed out and you just need that extra help, or you live alone and you might need a little extra help doing your laundry, just anything like that around the house, we are there.
Thank you. Julie, anything to add to that?
She did a pretty good job, but I would say, you can get services that would include nurse delegation as well. So even a little bit more complex care can be done at home. For example, if you had diabetic needs and needed help with diabetic injections or a colostomy bag or something like that, we can help with those items as well as the meal preparation and housekeeping and any care that's needed.
Thank you. Trevor, anything to add?
I think, pretty much covered all the bases, any activities of daily living, yeah.
Before we move on to looking at the placement agencies, I would like to ask you to explain nurse delegation. Anybody?
I can do that. Nurse delegate in Washington State, as a home care agency with that particular license, you cannot hire a nurse on your staff. You can contract a nurse, and as long as your caregivers have the right certificates, which is a training and their licensure and then additional training for nurse delegation and nurse delegation for diabetes. If they've got those classes under the belt, then the nurse that's contracted can train those caregivers to the client specifically. So the nurse delegator would go out and do an assessment of the client as well as train the caregivers on that client. So it can be adds an extra little layer in startup when you're starting services, because you have to bring in another person in an appointment and do that assessment. But and there's certain tasks that can be delegated by nurses, and there are certain things that can't be, and so it's really dependent on what the needs are. But a lot of the things can be delegated, like medication assistance or administration. If someone's on hospice and needs to have medication put into their mouth, for example, our caregivers, typically their state license allows us to put the medication in the client's hands, but we can't put it into their mouth. Once that becomes an issue, that's where either the family member has to provide the medication or it has to become nurse delegated. Hopefully that helps explain a little bit of it.
How about wound care?
Certain basic wounds, it can be delegated, but nothing that would be any serious wounds.
Okay. Debbie, can you think of other nurse delegation things that can be an issue or not? You're on mute.
We've had clients on feeding tubes.
Yeah.
We need to be delegated for that. There are certain, we've had clients that are totally immobile that you don't always be delegated on sit to stands or Hoyers, but there are times when it's helpful. The nurse delegate are independent contractors with the client, and we work under their license. It is every task that they delegate is specific to a specific client, and you are only delegated for that task with that client. If you do the same task for another client, you have to do the same thing with the nurse there.
Mhm.
Did you see that question pop up about wound vacs?
About what? I'm sorry.
Wound vacs. Is that a nurse delegated?
We cannot do anything with an open wound.
Okay. That answers it. Anything else you can think of? I have so many questions always about nurse delegation, so it's a good opportunity to talk about that a little bit. Can caregivers that go in the home, are they able to do nail care, particularly toes?
No, not even under nurse delegation.
Okay. And could you explain why that is?
Yeah, oftentimes as we age, our circulatory system is not as good as it once was. So an injury to a toe or a finger with someone that has circulatory issues can cause other problems, like not healing, a wound that doesn't heal. So if you accidentally nicked a toe, you could cause serious problems. So it's just a no-go for nail clipping.
Okay. So Christina and Sarah, tell us about placement. When do we start thinking about placement?
You can go first, Christina.
Oh, thanks, Sarah. We'll both chime in and support each other through this, I'm sure. Placements anytime. I mean, Sarah and I are helping people make plans for down the road. We're answering phone calls that are in crisis and trying to get people routed to the right place based on their preferences and their needs and their financial situation. So we are grateful to be here in Clark County, that we live here, we know the resources, and we can help walk families through that when they reach out to us. Our services are no cost to families because we have contracts with all the options that we'd want to consider in Clark County. We do not work with all of them because not all of them meet our minimum standard. And so we are vetting people, we are checking the state license website and making sure that people are above board and there are no issues with citations or investigations or those kinds of things. So we're helping people stay safe and get in the right lane. Sarah?
Very well said. Yeah, in an ideal world, for most people, home care would be the first option, whether it be for, a couple hours at a time, all the way up to 24-hour care. But for some families, that's just not feasible, whether that's financial, whether the care is just too much. Or it's some of the things like Debbie and Julie talked about that are beyond their scope, like wound care. And so in those situations, placement becomes the next thing. But then there's also other times where Christina and I will come across families where maybe they want to be in an environment where they have a lot of socialization that can happen, right outside their apartment door. They're tired of cooking, they're tired of maintaining a house or a yard, and they just want to have more fun and less work, less of the household things. So in those cases, we can provide placement services for them too. So it goes all across the board for when people are just wanting to move to that next step in life to, having to for various reasons.
And I think that Sarah and I both receive quite a few calls for people that are wondering about in-home care. So they are not ready for placement. And Sarah and I are not people that are pushing people. We are here to give information and educate people about the options. And then we're referring to them for in-home care and letting them know that we're here if something changes. We're on deck, we're part of the team.
Exactly. Or sometimes they call because they think they need to move and they're saying, well, it's to the point where mom or dad needs help with, taking a shower or just being reminded to take their meds. And in those cases, Christina and I can say, well, have you considered in-home care? And let them know that that's an option. Because despite what we do, the longer someone can stay at home, if that's what they're wanting to do and they can do, that's ideal.
So I have a question that just came up just before we came on related to 24/7 care. And the scenario is that an individual who has dementia was discharged from the hospital back to her normal place of living, which is in a memory care facility, and she is too agitated for them to be able to handle her, and they want the family to find other care for her. So is there an option in Vancouver for 24/7 care without being placed?
Well, I think that would probably depend on the circumstances, because if the memory care is saying that they don't feel equipped to handle her level of care, is that because she's needing more one-on-one care? And in that case, in-home care could potentially be an option where the person would be getting one-on-one in home. So I guess, I don't know, Christine, if you want to chime in, but I don't know, without knowing all the circumstances around that, it's a little bit of a tough one to answer, I
Yeah.
think.
Right, whether or not she could be appropriate for an adult family home where we were able to find a home that has wake staff at night and to be able to keep her safe. If she's an exit seeker, then that's not so. So these are the things that Sarah and I walk through with families and talk through all the different options and try to help narrow down what's the best scenario.
So are there times for the home care agencies? Are there times when you would assign someone a one-on-one care like that?
In the facility?
Uh, Either in a facility or at home?
Oh, sure,
Yeah.
yeah.
Hmm.
We can
Okay.
provide 24-hour care. And we've done it in, sometimes, usually it's for a short period, that it's not a long-term thing. It's maybe till they get medication situated, but we can be basically just a friend to the person in the facility until they get kind of on a better
Hmm.
plane, I guess,
Yeah.
more level. And we've done
Yeah.
that. But if it was going to be like, if she was going to be staying in that facility for long term, and I would start looking at adult family homes probably, or yeah, some solution that might be better suited. Not every memory care facility is exactly alike. So there could be a solution, and that's where these placement folks like Sarah and Christina come in really handy because they know a lot of those details that you need to understand when you're making a placement.
What
Good
would you
job.
say? And Trevor, I'll ask you this question. Is what would you say to someone who says that no one can take care of their loved one as well as they can? And that's despite the fact that they actually are seeking care.
I would say, it might be that way on an emotional level. But, I would say, it, caregivers become caregivers for a reason. They're very passionate about taking care of people and often want to learn client specific, you know, needs, wants, preferences, all of that stuff, and try to, kind of just as we do with our care plans, create the care around the client, and cater to them specifically in the way that they want to be.
And couldn't you also look at it as creating a team, Trevor?
Oh, of
The
course, yeah.
caregiver, like that's
And
how I
that's,
talk with families. Like, I'm part of your team now. Sarah's part of
yeah,
your team. We're here
that's what I
to
tell people
support
all
the
the time.
effort.
Yeah, we're
Yeah.
all a care team, all work together, yeah, to make the client's need met. So,
Can you kind of give us an overview of the costs of different levels of care?
so
I would
for,
ask,
oh,
go ahead.
sorry. For in-home care services, I think our current rate is, as of August 1st, 42.92, and we follow the Medicaid state rate.
Okay, and I know that CDM accepts Medicaid, but I'm not sure about Pacific Northwest Aging or about Home Instead.
We do
And
not. We don't have a contract with the government.
No,
Our
neither.
rates are a little different though. Our starting rate is 39 for basic care, and then it goes up, depending on if you need nurse delegation and we do charge more for nights and weekends.
okay, Julie,
Very similar that we do have, depending on the level of care that's needed, the rates start at 40 and go up from there. And there is a differential to get overnights and weekends as well, because you got to incent people to work on the weekends.
of course, of
Yeah.
course.
Yeah.
So you placement ladies, tell us about the costs of the different levels of care based on say assisted living versus memory care, and then of course the every time that another ADL is added.
Well, it's kind of all over the map. Really depends on level of care, wouldn't you say, Sarah? I mean, in assisted living, if someone's willing and interested in a studio, that's going to be the lowest price point. So just depending on what's happening in the world, 35 to 4,000 for a studio, yeah. And then you add care to it. So depending on what that looks like, I might tell a family that's looking for assisted living, plan for 6 to 7,000 a month, so that you are not surprised. And if it's lower, great. But then that's also, I'm guiding them around how to manage their money. So if it's going to cost 7,000 a month, divide that by the pot of money and let me know how many months can your person pay because that gives us feedback on are we in the right spot or we're not. So that would be for assisted living. What I'm seeing for memory care, 8 to 10,000 isn't out of range, really. And that may be for a shared opportunity, not necessarily for private at the lower rate. Adult family homes, I'm seeing, I haven't probably seen something as low as 6,000 in years. So, I just try my best to manage people's expectations when they call me, and I will just give them a range. But for adult family homes, there has to be a third-party nurse assessment completed, and that's in black and white. And then their provider tells us what the rate is based on what it says the care's needs are. So $8,000 to $10,000 wouldn't surprise me if somebody needed night care, were incontinent, maybe had needed diabetes support or wounds, that kind of thing. How about you, Sarah?
And I echo that. The ranges that Christina gave are spot on with what I tend to say too and what I see. One thing to note is when it comes to assisted living, what you're charged a base rate based on the apartment. So that would be, like Christina said, the lower end would be a studio, but a 1 bedroom, 2 bedroom, sometimes if they're a view or more, and then your care would be anything additional. And how your care is evaluated does vary on the community. Some of them will do, a la carte and just say, okay, you only need medication management, so we charge this much. And then some of them do them, in a points range. And so that's all based off an assessment. And then Christina and I have conversations with families, do you think there's a likelihood that this person may outlive their assets and their money? And if that's the case, especially when we're giving you these ranges, we need to look at places that would accept Medicaid and what's that time period that we have. We find that adult family homes can be a lot more flexible in the Medicaid spend down process because they're individually, owned. So they're not owned by corporations typically, so they can kind of make that decision. And they'll often look at, what they think the longevity of the resident will be because they don't like to have vacancies. They like to have, long-term residents as much as possible. So oftentimes they're willing to lower their rate and look at the fact that you would be, a private pay resident longer. And then with the bigger communities, a lot of times they might have a little wiggle room here and there, but for the most time they're pretty locked in with their requirement for how long you need to pay privately before converting to Medicaid.
Thank you. Trevor, can you speak to Medicaid? It's kind of what the requirements are and those kind of things.
So requirements are, I'm not sure the exact amount. It fluctuates, but it's around $2,300 a month income wise. And then for long-term care, needing assistance with some activities of daily living. Doesn't have to be all, doesn't necessarily have to be personal care, just some assistance with activities of daily living.
And Lynn, I just wanted to chime in on this topic too, that sometimes there are other financial resources, both for in-home care and, community or adult family home settings, that we would ask you about, such as, do you have a long-term care insurance policy, or would you qualify for aid and attendance, things like that. So I think all of us tend to have conversations with our clients, on that end too, to try to help you come up with those funds if they're available to you.
I think,
Could you go ahead?
we see all the time, it sounds like a lot of money when you talk about, placement or assisted living. But for an 8-hour shift Monday through Friday, it's $6,000 to $7,000 a month for home care services. So it's quite expensive, private paying, for agency care as well. So weighing out that need, how much care is needed, I think is a big factor.
It's a really good point.
I feel like the last time I did the math for 24-hour care was like 22,000 a month, something like that, in that range. So when somebody's wanting to stay home they can afford to do that, that's fine. I don't know a lot of people that have unlimited funds, but if that's what their choice is, then I'm supporting that and saying, yep, and here you go, and here's how to do it. Call me if something changes. But when we talk about if somebody needs 24-hour support, $22,000 versus 8,000, like,
Mhm.
what do you think? We'll try to help guide people through that.
Yeah.
And sometimes, and I think the home care experts on here can speak to this too. Sometimes you do the 24-hour care for a while, and I see sometimes it's not always the financial reason, but especially if there's a spouse still involved, even though you have the caregiver there, it's just can be a lot to have people in your home, but also you're still worrying about the person. And so sometimes to take care of your mental health, sometimes that decision to move the loved one, becomes necessary too. So,
Yeah. Yeah. There are factors that like that for sure. Because if you're caring for someone with dementia or any other type of illness that is round the clock needs,
Yeah.
the impact on your health is significant. They measured there was an article in 2012, CNN, and I can't remember all of the details, but I do remember you're 65% more likely to die. That's someone your same age that's not caring for someone. So as a caregiver, your risks are high. So you should factor that in to your thinking process when you're caring for someone too. Um, is this helpful for me to be always stressed out? Um, or could I be a loving wife when I go visit my husband at the facility? And we all have different answers to those questions, but there are always things to think about as well.
Sarah mentioned aid and attendance. Can someone describe that? I discover all the time that VA folks have absolutely no idea that something like that exists.
Yeah. Well, I know there's a qualification. You can have more assets and income than Medicaid. I know that, but I don't remember
Yes.
exactly what it is. But you can get 2,400 a month in tax-free payments from the government if you were in the military and served during a period of wartime. You didn't have to serve overseas just during that period. And it's a great benefit of
It is.
cash money.
Yeah.
and there's a spousal benefit too. So if you were the spouse,
Yes.
you didn't necessarily serve. I don't know if that's the same case for in-home care, but I know it is in the spousal benefit.
Yeah.
Um, and then the other thing to note, so I always suggest to families, if someone was served in the military, to make sure to check to see if you qualify for aid and attendance, because that actually is a requirement before you can go on Medicaid. If that is available to you, you have to use that up before Medicaid. So sometimes people are a little shocked because they do their Medicaid application and then come to find out, oh, we didn't use up our aid and attendance benefit. So, and we have a really good veterans, oh gosh, I'm drawing a blank on the name, but the veterans assistance, you know,
The veterans of foreign wars.
um, well, the downtown, the office down
The
there.
Veterans Assistance Center.
Thank you, Julie. And they will help you. They're volunteers. They can help people, for free, to try to figure that out. So the most important thing is have your DD 214 form. If you have that, they can figure everything else out for you. So
I have a couple more questions and then I would like to open it up. And what I'm going to do is I'm actually going to allow the people in your audience to talk to you.
Okay.
So, but a couple more questions. Are home care caregivers trained in dementia care?
Yes.
Yes.
Yes, they are. We, home care, the CNAs and home care, aides, they all have to do a 12-hour continuing education every year. And dementia course is required. We require it. Most classes teach it when you're getting your CNA. But there's some really good dementia classes and they do take them.
And we have a comment from someone that says, I just lost it. Clark County Veterans Assistance, the CCVAC,
That's it.
which by the way, they are going to be having a resource fair in the fall that has a ton of information for veterans. So
That's good to know.
that little aside thing there. So if you have a caregiver in the home, are they allowed to take you out for things like haircuts and outings and doctor's appointments?
Yes. Yes.
Yes. Yes.
And typically how it works is if the client has an insured vehicle and they're comfortable with the caregiver driving them in their vehicle, caregiver can take them, or the caregiver can use their own car and we would invoice the client for those miles and reimburse the caregiver for any of those miles she's done.
Okay, good to know. So what if a client doesn't like a specific caregiver? Can they have a new one?
Yes.
Yeah.
Both of our companies do our best to match the right caregiver with their client. It's very important.
Yes.
Is there another way that that can be handled? Do you ever mediate, or is it just not worth it?
I know we coach our caregivers if it's something that's coachable. We would go that route first, but if not, then we would look for a different caregiver. I'm sure that company works.
Yeah. Caregivers that have been with us for a while kind of know the drill. They know they're not going to fit with everybody perfectly.
Mhm.
A lot of them are adaptable and really do adapt to any environment, but they know too. But we can do it on very professionally, and it's usually there's no blame. Sometimes it's just not a good
No.
fit.
Yeah.
And every once in a while, it can be a caregiver that disappointed the client and us as well. And that's something that gets handled too.
So can you describe what is involved in caregiver training? Are they certified nursing assistants?
Yes, they are they have to be a home care aide certified or a certified nursing assistant or in training. But they have to have completed a certain number of hours of training in order to start.
And
Yes.
what is that training? Is that through the state? Is that local?
It's through the state. It's
Yes.
and CNA there's local organizations that teach the CNA class, but they all have to be registered with the state. And the home care aide is also, there are private companies that provide that training. We will pay for it as if a caregiver is interested in becoming a certified nursing assistant or a home care aide and they want to work for home instead. We'll put them through either one of those trainings.
Is that how it works for CDM, Trevor?
So we only put caregivers through a home care aid license training. But it's really focuses on activities of daily living. So transferring bed to wheelchair, how to properly brush someone's teeth, how to properly distribute medications for a client to take, really specific on those kind of tasks. Peri care, how to properly provide personal care, to properly wash your hands, keep your client safe, keep yourself safe, that kind of stuff.
Okay. How about you, Debbie? Anything different with your training?
We do in-person training every 3 months where we review old skills and learn new ones. And we do pay for their in continuing education. We have a program where they can do a class every month. We are trying to get where we can pay for the home care aid. We're setting that up now.
Okay. So a question here. I was overwhelmed with my parents' hospital stays and they still didn't want home care when they got home. My mom swore that they didn't need any help at all and actually offered her help to others who might need it. What can people do if they have no one, no family or close friends to take care of them and they live alone and they have dementia and they have Medicaid, what would you recommend?
Well, there is a new program that we've been doing for a little while. It's called the Are You OK Friendly Caller Program. And it's not billed to Medicaid. I don't think there's any cost at all. But it's simply a phone call as often as someone wants to check in on someone to give. I don't think they can give medication reminders, but at least check in, make sure that they're okay. And then, of course, if any follow-up is needed, touch base with loved ones and that kind of thing. So it's always another option.
And I would suggest maybe setting them up with something like Meals on Wheels for delivery, because then that delivery person could be checking in on them as well. You know that they would be getting meals, but then also it's a face, a couple times a week that is seeing them. So if they saw, a really drastic change, or, they fell and nobody was there, something like that, there's at least someone.
Did we
So
answer that question? Do you feel like that question was answered?
Sorry?
I'm asking Lynn,
Oh, I'm sorry.
was that question answered? Do you feel like?
I think that's really helpful.
Okay.
Because that's, we have this alarming statistic about 1 in 3 people who with even mild cognitive impairment live alone.
Yeah.
So that's a heck of a lot of people.
Yeah.
Sometimes a call to APS, Adult Protective Services, might be appropriate, because if the person is really unable to care for themselves, or you're concerned that they are not getting what they need, then having somebody official hop in, and then they may reach out to one of us to help.
Yeah. Yeah, that's a good suggestion.
Thank
That's
you.
so does that happen? Does APS actually reach
Yeah.
out?
Yeah.
Yes.
Yeah.
If you're concerned about self-harm, if they're refusing care and you feel like they need it, and you have I would want to document before you call, document exactly what it is. Are they refusing their medications? Are they refusing bathing? Um, that type of thing. So when you call Adult Protective Services, you have information to give them that would be
Mhm.
helpful, that they can use when they go talk to the person. And if you're thinking that they would be better in an assisted living or somewhere in a community setting, we suggest, if there is a hospitalization, that is a time, take that opportunity to use that, maybe to seek placement instead of going back home, because that can be a pivotal time for folks. And the placement folks can talk more about that, but I see that as an often effective time frame or use of that.
So is there ever a time that you would fire a client because their behaviors are so difficult for your
Yes.
counselors?
Yes.
All of us are saying yes.
Yes. Yes. Yeah. You work hard to get your caregivers hired and trained. And if they're not looking forward to going to that client's house, and what happens is the caregivers call out for that client, or they'll call and say, I don't want to go back. And that makes it challenging. We got to keep everybody happy. And it's not because someone has dementia. It's because there's someone in the house that can be mean or not very good at communicating, or
They don't want the help.
yeah.
Also,
Yeah.
it's like, get out of my house. I don't need it. We're like, yeah, you do.
Yeah, that too. So
APS.
yes,
So I have to apologize. Zoom has reformatted their screen and I didn't see these Q&A questions. So I see, Julie, you were attempting to answer this as I'm disturbing you. Can you please address the costs of 24-hour in-home care versus placement in memory care? Is in-home care more expensive? I actually think we answered that, but it would be good to say it again.
Yes.
yes, for
Yes.
round the clock care, it's Yeah, it's going to be 3 to 4 times the cost of an
Yeah.
assisted living.
Making a
Yeah.
move. Yep.
I do remember the math between somewhere between 8 and 11,000 a month as opposed to
Yes.
$22,000 a month.
Probably
That's
closer to 30, right, Julie? Would you say 24 in home care is probably a little closer to 30?
30, probably 30.
Yeah.
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 wow.
Calculated at about 29,000, yeah, a month.
Wow.
22, if you're getting 22, you've got a deal. Stick with it.
Yeah.
Okay, we have a question here. I'm needing to get a power of attorney for finances and healthcare. I printed off the forms. Are the forms legit or do I need a lawyer?
That's probably a Debbie question, I think.
Mm.
We do healthcare power of attorney, and we would be happy to do a complimentary session with anyone. Just come in, talk about, give us a call, we'll do about it. Uh, we do POAs. We don't handle people's money. We just do the healthcare end, and we would be happy to talk to anyone about that. And we would refer you to some really good people that could take care of your POA needs.
We also have a question. Are adult family homes generally more expensive than memory care facilities?
I think it's pretty comparable,
Yeah,
depending on the level of care.
right, exactly. It used to be that they were less expensive, but as their costs have gone up pretty significantly over the years, we're seeing them be a lot more comparable. And again, depends on the level of care. Occasionally, it can be more expensive if you're getting into needing the awake staffing. But that's usually because you might need, maybe someone is constantly trying to get out of bed. And so you need, a caregiver to be able to get to them rather quickly, versus having, 10, 12 apartments to get to. So, but pretty close most of the time.
I think we pretty much answered this, but I'm going to ask it anyway. If a person with dementia is living alone and you're questioning whether they're eating or eating properly, is there something that can be done? Is it possible to get the Meals on Wheels? Does it cost money?
Meals on Wheels is free.
If it was me, I would probably make the call to Meals on Wheels to set that up for them. And then my next call would probably be Adult Protective Services so they could go out and evaluate the situation.
Okay, specific question for Christina and Sarah. What timeline and circumstances would be the time to contact you for placement assistance? How would we know?
Before you need us. That's what I always say.
Sometimes I'll ask a family, what's your line in the sand? Like you've been caring for your person for a long time. Is there some kind of situation that might occur where you would say that's it? And sometimes people have said, well, if he becomes incontinent, I'm not doing that. So like getting really clear on what is it and helping guide them through that. And that might be helpful. So for you all on the call, if you're a caregiver, think about that. I'm willing to do all of this, but not that. And there's your potential answer. Um,
And I think it's important to have those conversations with your family members too, and talk to them about what your line in the sand is, because I think in the moment, sometimes we can forget and go, okay, well, I can just, this might pass. I can do this for a week. And then before you know it, it's been a month and then it's been 6 months. But when you're starting to compromise your sleep, your health, your meals, things like that, then it's beyond time, at that point. And, I know Christina and I work similarly. Just give us a call ahead of time, and just open up the conversation about what it looks like and what does pricing look like now and what communities are in my neighborhood and do you recommend them? And it doesn't mean you have to go tour and look at them, but if you want to, we would both happily take you to go do that. I actually am working with a family right now who was on this webinar last year, and we've been in contact over the last year, and it's, she's now ready to make that move for her husband. So it's never too early to start talking to us, and it doesn't commit you to anything. It just kind of keeps you in the know of what's going on so that if you do have to make an emergency decision because there is a hospitalization or something, you've already opened that door and you've developed that relationship with us, and it will feel slightly less overwhelming.
Yep.
Uh,
Yep, you've built your team. We're here to help.
Debbie, can you repeat the answer to the power of attorney question? It says her internet cut out.
Oh, I'm sorry. PNW Aging, we do healthcare power of attorneys. And I'd be happy to explain what that is and why it's so important. But we do not do power of attorneys. We don't handle people's financials situations, but we do refer you to some good people that can help you with that.
I had a feeling that the question was about, are the print offs, if they print them out and sign them
Are they
themselves,
legit?
are they good? Are they legit?
Yeah,
I think if you take them and get them notarized, they're good. You might want to just talk to a company, and it necessarily has to be a company like us. We'll tell you for free what you need, what questions we ask we're very in depth so that we make sure that your final wishes are carried out. Or if you're not able to make a decision for yourself, healthcare wise, we want to know exactly what you want. And we follow those directly and the way you want them. But I think if you print them out and you get them notarized and you give them to the proper people, then that's what they're going to follow.
they are legitimate. As long as they are appropriately witnessed or notarized, they're legitimate. That doesn't mean that they're correct or
Yeah.
that you should have done them that way, but they are legitimate. So
Yeah.
Another question: if a person with dementia lives alone with their spouse, caregiver, and the caregiver is one of the 65% that dies earlier than in the general population, what comes into play if the dementia patient is left alone without other supports?
Without other supports, the state will step in and appoint a guardian and take over the finances until typically that's what happens.
Whereas right now you may have some choices to make. If a crisis like that, then there is no choice, and then someone will decide.
Yeah.
And that's also where a healthcare power of attorney comes into play. If you've already got it designated, who's going to make the decisions for you in a situation like that.
Yeah.
And then if you don't have anybody, if you don't have any family members who can step in and do that, that is where there's companies like PNW Aging who can serve as that POA, that person for you. So
Well, I would love to give you a picture as somebody that worked in a hospital for a lot of years, and when we run into people who have no one, what happens is that the hospital gets a guardian ad litem, that is a temporary guardian. That guardian ad litem will go to court and have a permanent guardian assigned to that person. And it's a very onerous procedure. And if we're lucky, it's somebody that really has their best interests at heart, but that is what ends up happening. So I wonder if this may not be a fair question, but I'm going to ask it anyway. Can you guys speak to a backup plan? What would a backup plan look like to each of you who deals with this every day?
Yeah, we like to have backup plans. Uh, what will happen? And often if we will end up doing 24-hour care while the spouse is in the hospital. And if that's the case. Usually we're working with family too. We don't have a lot of orphan clients that don't have families, but on occasion we do. And it is concerning when so you talk with that person about their own personal backup plan and say what happens when, or what happens if, and what are you going to do? And and kind of work with them or talk to them. I had one client where I knew that he was going to live longer than his money, and he was trying to do it at home, but it wasn't going to work. And to me, I thought your backup plan needs to be go find out where you could move to, go do some tours and see what might be appealing to you. So when that time comes, you're ready to go. So that would be a backup plan. Having a conversation or relationship with a placement agent who might be able to get you placed quickly. That's not always ideal. Um, Planning is a little better, but they can be a backup plan too.
Anyone else? Do you end up dealing with crisis placement people?
Yep.
All the time.
Yeah. So, of
Every day.
course, we both have families that we've worked with for a long time that, have reached out and it's time. Oh, it's not time. It's time. It's not time, back and forth because it's hard. It's a hard decision. And so some families have identified their first, second, and third choices, whether it's, whatever type of community that is. And that's fine, except when it's time, if there's a crisis, those three may no longer be options based on a change in level of care and what we've done today. So, in 6 months down the road, things might not, it would just, but we're well equipped to help you. So we can shift and get you where you need to go. But sometimes it can give you peace of mind to settle in yourself going, okay, these are my top three choices. And then I just know that if there's no availability when you need it, we're just going through the process again, but better and faster because we know what we're doing.
Sarah, any other comments about crisis mode?
No, I mean, I think anybody who's on this webinar watching this alone means you're probably trying not to be in crisis mode. So I applaud you for taking the time to do this and to be here because that's the first step. And but when crisis mode happens, we just all dig in and handle it and pull every resource we possibly can, whether that be each other here and our other resources. And we're really fortunate in Clark County to have so many resources, and all of us are so connected and will help each other.
Yes.
So it is not uncommon for me to call Christina or Christina to call me and go, I'm at a loss with this one. What do you have? Can you help me? So, and sometimes it means someone may be in the hospital or the skilled nursing a day or two or three longer, in those cases, but we don't give up. We'll keep doing what needs to be done.
So what do you know or feel has been the impact of some choices on the care partner? What kind of experiences have you had related not so much to the person who is requiring care, but that person who is trying to find the appropriate care? Do you have examples of what you know has been a result?
Oh, so successful implementation of a home care plan.
That or not? Yes.
Not, yeah. Yeah, well, yeah, it really makes a difference in their life when they can get to their own doctor's appointments or go have lunch with their friends or play tennis or whatever it was that they quit doing to care for someone. It can bring a lot of peace to them and a little bit of respite as well. So yeah, for sure, it has a good impact.
I think most of the time, what I hear, or I think what we hear, whether it's a home care situation or, moving placement situation is, I wish I would have done it sooner.
I had no idea I could feel this much better.
Yeah.
And I agree with everything Julie had to say, and just knowing that someone is there to take care of any need that your loved one might have, so you can just go take a breath. I've had people just go in the bathroom, take a hot bath for a couple hours and read a book. Things that they're just not able to do. And we all work together so well. If we can't staff or take care of someone, we'll call the police company or she'll call us. And we work with all of them so well.
Yeah, we've
I
been
think-
really fortunate.
Yeah,
Very.
I think people that don't live in Vancouver don't appreciate what we have here.
Yeah.
True.
It is not common that all of these agencies work so well together. I love that about all of you.
Yeah.
So there's a question that says, how can we contact any one of you for help? And what I will do is I will send out contact information for every agency. Thank you guys for being here. And then there is
Thank
a
you.
question when looking for an adult family home, what are some good questions to ask the manager of the home? And if I'm visiting them, when should I visit? What should I look for? What should I care about?
Well, I provide all my families before we go on tours some frequently asked questions and questions that I find come up often. And I make it a Word document so they can delete ones that might not apply to them specifically or add any of their own to kind of get their minds thinking. As far as the visitation, adult family homes can have suggested visitor hours. So kind of the times that they would like you to visit, maybe to avoid, getting people up in the morning, but you really can go visit your loved one anytime if you want. If it's in the middle of the night and you just say, I feel like I need to go check on my husband, you have the right to go and do that. So
I feel beyond the questions, if you go with your gut, that's really going to tell you whether or not that's a fit. It is how I feel. And that's not scientific in any way. So I'll just share that with you that if all things are equal, if Sarah and I have done a good job and offered up options where the history is that they've had good care in the past, etc., all the things are the same. When you walk in the door, how did you feel? Were you able to communicate with the provider, the owner? Do you feel like that could be a partner in the care with your loved one? So that is beyond the what kind of meals and what is what's the daily stuff going on here and what about the hours of visits and all of those things that are important. It's really, I feel, is a gut level that is how you decide. And families may ask us, well, what do you think? And I'm like, I cannot advise you on that. This is your situation, and I have given you options that are solid. And one of these, which one feels the best to you? And I may talk, Sarah and I help people decide through it and talk through it. But our role is not to decide for you, but to just guide you and give you options.
So what is your feeling, because we talk about this a lot, is about the fact that say I've put someone in either an adult family home or in a memory care, and I am told that we want you to stay away for 2 weeks.
I think it always depends on the situation. My thought process on it is that to not start out that way. But if you're getting feedback that after you're visiting, the person is becoming more agitated and it's upsetting because then you're leaving and they're realizing they're not going home with you or you're leaving them there, then sometimes having that gap just so that they can get acclimated and really get comfortable with the staff is helpful. But for other people and other times, it doesn't. That can make them, upset and overwhelmed. Like, where is my loved one? I don't understand. So I think it's definitely a case by case scenario, and it's not black and white. That's my opinion. I don't know if you feel differently, Christina, or how
I
you.
do, I do. And and to talk it through with families around how do you feel about that? And, for some people, having that break, that's good for the caregiver to have that break. At the same time, that's your loved one and you've just left them. And that's how it feels. I've abandoned them. So, we're talking through these things to help people decide what's best for them. But your initial question was, what about the community that says this is our rule? If they say that, then I'm likely talking with my family outside of the meeting and saying, how do you feel about that? What does that look like? Because if they're on board with that, then that's their choice and I can help guide them. And if they're not, then we're looking at the next option that isn't requiring that. So we're trying to be as neutral as we can in supporting people to, again, get where they need to go.
Home care people, how do you feel about that?
Does anybody go?
And you don't have to answer.
Well, my guess is that they come from a place of they've done this before, so there's a reason for it. But
Mhm.
I can't imagine telling someone not to visit their loved one. So yeah, it's if it means that there's a better chance of success, then you got to think about it.
Mhm.
Um, but everybody's different.
And does that ever
Yeah.
come up with you guys, Julie, the in-home care people where, you probably see it a little bit sometimes too, right? If you're coming in and you're providing respite, but maybe the spouse is still there trying to do things. Do you ever have to navigate that where it's like, we're here so you can have a break?
Right. Yeah, well, of course, yeah,
Yes.
they'll be cleaning their house before the caregiver gets there. And
Mhm.
I'm like, no, 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 no cleaning. We're not the guest. You don't stress for us. We're gonna help you with all of those things. So yeah, we do have to kind of let them know that we're there to help. So let us do, especially, I mean, we don't want to take over things you enjoy. Let us take over the things you don't enjoy. So you have more time for the things you do.
And that is some, I'm sorry.
Sorry, I just truly believe that people often don't understand that your home care agencies, when people come into the home, it is to help in whatever manner. Although I know that there are things that they are not allowed to do. Can you kind of speak to that?
Not allowed to.
Yeah, is there things that if I ask you to climb on a ladder and clean my gutters, would you do it?
That
No.
is one thing that I tell people at intake, that our caregivers are not allowed to leave the ground. They can't stand or on anything. They don't move furniture. Um, we don't do anything like that. And to address the other question, sometimes when I'm doing intake, I will have people tell me we have a 4 hour minimum, and they'll say, well, how am I supposed to entertain them for 4 hours? And then we open up the conversation to where you don't entertain them. I will have a care set where they'll stay busy and we'll start working on it. Just, wouldn't you like your bathroom clean? Wouldn't you like your refrigerator cleaned out? Sort of things.
Hmm. Yeah, there's a lot that we can get done in 4 hours.
There's a lot.
Yeah.
Do they get paid extra for cleaning out the refrigerator?
Nope.
No.
They
And I
should.
always recommend that, because people are used to being hostesses, not
Yes.
everybody is, but some people are, and they'll feel like they need to feed the caregiver or include them in their meal and or give them a tip. No tips,
No
not
tips.
required to provide their meals. You're not required to provide their lunch. Um, if you do want to invite them to a meal, you're more than welcome to. But I always say, start out the relationship the way you want it to be 6 months from now. So if you feel like 6 months from now, I really don't want them eating lunch with me, don't start it. It's like it's setting your boundaries from the get-go about because
Right.
you gotta know what you'll be comfortable with now and 6 months from now. So caregivers are there to do a job, and they really like being busy. So if you've got a list of things to do, that's always helpful too.
The question in Clark County, what is the lead or wait time for placement, especially if it needs to happen quickly?
It depends on the community.
Mhm.
It depends, what you're looking at as far as how long private pay you can be or Medicaid, and what care setting you're looking at, adult family home versus memory care or assisted living.
Yeah. Sarah and I work with urgency. So if you have a crisis and you're calling us, we're trying to help figure out what needs to happen. But if it's on, Friday night at 7:30 at night, the communities aren't open, to try to help us figure that out. Maybe on the weekends, adult family homes as well. We're helping to get people the support they need. But we are relying on our relationships out there where people are responding to us if it's after hours, that kind of thing.
The number one holdup I see in placement is they have to have doctor's orders if there's medication involved, whether that be assisted living, memory care. And so without the doctor signing off on those doctor's orders, they cannot physically arrive at the community. So that's often the holdup, especially if you're talking about, a Thursday afternoon, Friday, Monday.
Mm-hmm.
Is there a difference between assisted living and an adult family home?
Yes, so an assisted living is what we call a community setting. Some people will refer to it as a facility, but a larger community. And an adult family home is a residential home where typically they have 6 to 8 residents that live there. And then there's some nuances as far as care provided in that too, but they're vastly different.
And
Not
even
everyone.
assisted livings can be different.
Yes, in every assisted living. And for someone to be in an assisted living, they have to be deemed that they would be safe behind a closed door when care is not being provided. So if someone is unable to pull a pull cord, to be able to ask for help, um, things of that nature, then typically assisted living is no longer an appropriate setting for them.
Agree. Good job.
Thank you.
So somebody mentioned 4-hour minimum. Is that standard?
I
It's
think it,
just what our company does. I don't know if it's some companies do 2 hours, but 4 hours is what we've decided. It helps the girls if they have 2 4-hour shifts in a day, then they've got a full day's work.
Trevor?
I think it varies by agency. Yeah, we have a 2-hour, some 2 hour, some 4 hour.
Julie?
We're 4 hours. We evolved to that over the years for the employee to be able to get the hours they need during the day and to be able to fill the shifts consistently. We found that 4-hour shifts work better.
Okay. So we would like, first of all, we want to thank you all for being here. We were talking before we came on the air that this has been a very long day for everybody that's here. So we really appreciate you being here. So that's one thing. The other thing is, oh, wait a minute. Somebody just asked another question. Is home care called into hospitals for care or for situations for people with dementia when there isn't enough staffing for the one-on-ones?
I've done that before, yeah.
Mm-hmm.
Typically when it's dementia and they have a broken leg or hip or something and they don't remember and they keep trying to get up and the hospital staff can't cover it, then we've come in and sat with them.
And who paid you for that?
Depends. We've had it where the family paid us because they couldn't be right there, or we've had it where the hospital paid us.
Okay.
We've done the same.
Well, that's good to know. So speaking of challenging behavior, what about home care and placement with someone who is challenging? What's recommended and how's it navigated for both home care agencies and for placement agencies? Does that create issues for you?
Difficult behaviors always can create issues. That comes down to the caregiver match. You know, we can have one caregiver, we can send 7 caregivers in and one of them has some magic and it works. And you just don't know what it is. And you wish you could clone them so you could cover the other days of the week. But yeah, it just depends on the behavior, depends on if we can get a good caregiver match. Um, and then sometimes you have to get creative in how you introduce. If someone's dead set against ever having care, then I probably would introduce the person as a friend of somebody's that's going to be here for a while. Or, not a caregiver, just it's so-and-so's friend. And sometimes that can work as well. So you just have to get creative when you have challenging behaviors.
Okay. So what is the requirement for, do you have the ability to, if there is no place for a person to go, does the hospital have to keep them?
We have been paid by the hospital to do in-home care up to 24 hours a day for clients until they can get them situated in a different setting.
Yeah,
So-
they sometimes will opt to do that kind of thing versus keep them in the hospital. You can push off a discharge for a couple of days, but they'll be pushing you to get something in place.
Yes.
The hospital is required to make sure the person has a safe discharge in order to discharge them, but what that can look like can vary across the board. And I think as long as families or whoever the point of contact is making that effort to find that safe discharge or put together that safe plan, they're usually really good about it. It's kind of when people try to ignore it or hope that, the discharge planners just come up with the plan, that's where things can get a little dicey. And
Usually,
that's where calling Christina and I can help. And it might be a referral, back to in-home care or temporarily, bringing in-home care while we figure out another situation.
yeah, usually if they're in the hospital, if the family says, I'm working with Sarah, I'm working with Christina, the hospital just like takes a couple notches down. It's like, oh, okay, good. You're in good hands. They're friendlier. I mean, because something's happening. They know that we're working with urgency, that we're trying to help figure this out.
But they won't take somebody and just be like, well, you gotta go. Your time
No.
is
Yeah.
here.
No. However, if the family says, okay, and you take them home, then you're back to square one and there you go. So some coaching that I might have with a family is if my person's not wanting to go on their own and they said no, and okay, if you have a crisis and you land in the hospital, like Julie was saying earlier, that's another decision point that you could loop us in for us to help you figure out what to do from the hospital. It's much maybe more easier. I don't know if it's the right word, but it from the hospital to a community or adult family home or memory care, wherever they're going, can be an easier transition from the hospital than it is from home into the new place.
Because you
And
can blame it
sometimes
on the
families,
doctor.
yeah, have success in saying, this is what the doctor said needs to happen so that you get the care you need, so that it takes the spouse out of that. I did this. I made this decision. So anytime you can have somebody else help you with that and shoulder the responsibility to is helpful, I think.
Mhm. And sometimes that actually is the case. I mean, Christine had, I don't know how many calls where it's a spouse saying the hospital said, I cannot safely take this person back home. I
Mhm.
have to find somewhere now.
Right.
But we hope that you avoid that situation.
Yeah.
And
Yeah.
one of us can come into the mix and help you before that gets to that point.
So I have another question related to once you place someone, is there a minimum commitment period? What if we're not pleased with the care? What are the options for moving to yet another facility?
So you would typically give a 30-day notice if you want to go somewhere else. You want to reach out to us and talk with us so we can help get you in the right place or talk about what happened or why that's not working out so we can understand. And then you give your find the option, give your 30-day notice and move them. I mean, we'll talk you through all the technical pieces of it. But yeah, you have every right to make a change.
And
On
conversely,
the,
what if,
the front end too, because typically people, there is an adjustment period. So, depending on the situation, if after a week or two, it seems like the person isn't adjusting well or adjusting as well as you thought they would, sometimes it's a matter of giving it more time. And again, that depends on the situation, but
For sure.
45 to 60 days is an ideal transition time for most people.
so conversely, suppose that the facility says you need to move them. Do I
Yeah,
have to move
so-
them tomorrow? Or do
Well,
they have to give me a 30-day notice?
Technically, don't they? They have to give you a notice. They might ask you nicely, hey, we don't think this is a match. Can you look around? And if you're not taking action, then you may get a notice, formal. But they see you taking action and knows that you have reached out to Sarah or me or someone and we're working on it, then they're watching to, okay, help you out. That's been my experience with the
Yes,
community.
so, well, that was a trick question because yes, they do have to give you a 30-day notice.
You're
They,
not Elin.
they do with
Your name is on the list.
they do
Sorry.
with some exceptions, actually, because for example, if you're in assisted living or you're in an adult family home and the person is exit sinking, meaning they're taking off, they're wandering down the road, they're not redirectable to come back. In those situations, it can actually be sooner. Or they could require that you either bring in-home care or you come and stay with the person until you find that discharge. Those are some extreme, situations, but there are a few. When a person moves in somewhere, they're provided a service agreement and a disclosure of services that says what they provide. So if there's anything outside of that disclosure of services, they do have the right to ask you to move. But that again is a step that Christina and I walk you through and talk to you about when you're moving somebody in somewhere.
And that's why you want to get it right the first time.
Yeah.
Yeah, it's traumatic
Mhm.
without a doubt, it is traumatic to make those changes. So we have a few minutes left and I warned you guys. So now I'm going to ask you if the one thing that you wish that everybody knew about either home care or placement. And anybody can start.
There is help available.
Perfect.
I think all these people have made it very clear, phone calls can be made and help can be had. So
Like that.
I'm all
Help
here
can
to
be
help.
had.
Perfect.
It's
I
never
totally agree with that.
It's never too early to gather information
Mhm.
and to take the information in. It doesn't mean you're making a decision.
Right. We are grateful to help you put a plan together, and it is at no cost to you to call us.
So how do you get paid?
So we have contracts with the communities that we refer to. And like I said earlier, I do not have contracts with everybody in Clark County because they don't all meet our minimum standard. But I'm transparent about that and let people know. But basically, like a realtor showing options, that community that you pick would pay, in my situation, pays my company first choice, and then I receive a portion of that. That's a sales part of my job. But the good news is because we have so many people that we work with, I don't have to worry about that piece. I get to worry about what's the best option and then providing those options for families to consider.
Julie, what do you want everybody to know?
That it that everybody's unique, but you're also not unique. In that there is kind of a predictable process that happens as we age. Our aging process is somewhat predictable. And people that work in the field see it and have an advantage and have information that what's wonderful is that they're happy to share it with you.
Debbie, didn't hear from you.
I agree with what Trevor said. There is help out there and there's so many different types of help and you should just call us and any of us would refer you. If we're not the person that's right for you, we'll send you to the right place. We'll help you find the right place. We all will do that.
Yeah.
I see a question. I thought I was done.
Mhm.
Sorry, you can't go yet.
All right.
Do companies have contracts with multiple placement agencies?
Do you mean
Yes.
companies like communities companies, Lori?
I believe so.
Is that what she means?
Oh.
Mhm. Yeah. Yeah, but Sarah and I are the best, so that don't worry about that. We'll get you where you need to go.
They
Yeah.
do. I always tell families that in a roundabout way, you are paying for our service because the placement fee that they pay us is built into their advertising and marketing budget. And so utilize us because you are paying for it in a roundabout way. So let us do the work. Let us take that load off your shoulders. But yes, they work with multiple agencies so that multiple people will hopefully bring people to come to their communities and move them in. So,
And no one wants to pay for anything, right? However, the communities are grateful to work with us because we know what we're doing. So Sarah and I are being very intentional about who we're recommending. And so we're not wasting anybody's time or effort. There's an online agency that people know. And when you call that online agency at 2 a.m, they blast your name and number out to everybody that they have a contract with. And then your phone starts to blow up and you're overwhelmed. And then you land to Sarah and I, and we are trying to fix that so that you're not having to deal with all that. So that isn't what happens with us. We are specific about where we're going to go, and we do not share your contact in here. I don't think you do, right?
no,
So no, the
until you're ready.
marketer, the community does not get your phone number. They have to come through me, or they have to come through Sarah
Until you say you're ready for
until you give it to them and say it's okay. So we're protecting you and we're right there in the middle. So they're grateful to work with us because we're bringing people that are qualified and that we already believe they're going to be a good match. And so their dollars for advertising are well spent because we didn't waste their time with somebody that wasn't qualified or appropriate.
So I think that's a really important thing for people to know, and I'm going to say it so you don't have to.
Thanks, Lynn.
Beware of national companies.
Thank
Not
you.
because they're not because they don't do their job, but because they're national. And that person that you're talking to might be in New York.
Mhm. Yeah, they don't live
So
here locally.
to save your time, it's better to look locally. So that's just my comment.
Yeah.
And I have a thank you. It says, I so appreciate all of you for doing this webinar. I have made so many phone calls, scoured the internet, trying to find help for my family. I'm so lost and upset. I found hope and have been led to this. This is awesome. Thank you so much. And I have another comment here that says, you guys are fabulous. Thank you. My personal comment is I think you all are amazing and we are so fortunate to have you in our community. So thank you, thank you, thank you.
Thank you,
for having
Hope,
us.
for being here.
Thank you. Hope.
Yes, thank you.
you hope.
All right, everybody gets to go and eat and take a nap.
Bye.
Thank you all.
Bye. Thanks,
Goodbye.
everybody.
Thank
Bye.
you.
Thank you.